And good morning. My name is Dr. Farali. So today is our topic is about the heart failure. First of all, we have a simple review about the function of the circulatory system, the transport of the transport is the main function of the circulatory system, stabilization of the arterial pressure, circulatory system of delivers O2 to the tissues and provide nutrients. Circulatory system carries waste products to the kidneys and other excretory organs. Heart failure. Heart failure, often called the congestive heart failure or congestive cardiac failure, occurs when the heart is unable to provide sufficient pump to the distribute blood flow to the meet the needs of the body. So heart failure is global term and the physiological state in which the cardiac output is insufficient meeting the needs of the body. Often it is termed as congestive heart failure or CHF. This is the most commonly caused when the cardiac output is low and the blood becomes congested with the fluid due to an inability of heart output to properly match with the venous return. Heart failure. Heart failure may be caused by the myocardial failure, but may also be occur in the presence of the near normal cardiac function under the condition of a high demand. Myocardial failure or condition of the high demand. To maintain the primary to maintain the pumping function of the heart, compensatory mechanism increase the blood volume, cardiac feeling, pressure, heart, and the rate of the muscle mass. However, despite of this mechanism, there are progressive decline in the ability to the heart to contract and relax, the resulting in the worsening of the heart failure. Reasons. It is the main reason. The main reason is the myocardium injury, myocardium overload. Myocardium injury means myocardium hypoxia or ischemia, or in myocardium overload, increase of the heart outflow resistance. Mixed heart insufficiency variant. It is right at the combination of the myocardium damage and its overload. Overload when of the inflammatory myocardium damage, the valvular heart violation are combined. So it is the acute pulmonary edema, as you seen in the X-ray picture. Note the enlarged size of the heart, apical, vascular distribution, and the swell bilateral of the pleural effusion. The chest radiograph shows the enlarged of the cardiac silhouette edema at the lung being seen as you are clearly seen in this picture of the X-ray. This is in the history is presented a case. Heart failure can be divided into the four stages. The stage one, the patient are at high risk of the heart failure but have structural heart disease or symptoms of the heart failure. Stage B means the patient have the structural heart disease but have no symptoms of the heart failure. Stage C, the patient have the structural heart disease but have the symptom of the heart failure. Stage D, patient have refractory heart failure requiring the specialized interventions. Compensation, the stage one. Crash phase, main sense means the compensative hyperfunction to and the stable adaptation phase, and the decompensation means exhaustion. Crash phase means the cardinal mechanism and the extracardinal mechanism. HB increase in and systolic volume is also increase, heart index increase, and heart work increase. But in the extracardinal mechanism, increase of the auto utilizing the tissues, reduce of the peripheral vessel and the resistance reasons. In increase of every cardiomyocytes loads physiological adequate excitement, relaxation of the excitement and the contraction, adequate contraction and the energy provision. So the adequate excitement means is based on selective penetration of the sodium, potassium, calcium due to difference between the extracellular ions concentration and the intracellular ions. Result will cause the depolarization. Relaxation and excitement of the shortening diffuse the depolarization wave inside the cardiomyocytes. Calcium penetration into the cytoplasm and the calcium connection with the troponin release of the myosin and the shortening of actin and myosin. interactions. Energy provision like glycolysis, mitochondrial activation, CRPH reserve. Most sensitive like in the depolarization means sodium, potassium ATPase and the calcium ATPase control the ions of the transportation at the concentration gradient. Excessive calcium concentration causes stimulation to the mitochondria and blocks the ATP synthesis. This is the heartbeat increase. Functional when it increase the penetration of sodium and cytoplasm and calcium in the cytoplasm inside, decrease the depolarization interval. If it's possible, if activity of sodium and potassium ATPase and calcium ATPase is high and adequate, and ATP synthesized in mitochondria is adequate, sodium calcium regulative mechanism is adequate. Increase of shortening of power, like the heterometric mechanism of the homeometric mechanism. It is the same, mean the simple step like calcium blockers troponin, and the calcium concentration in the cytoplasm increases. The after that the limitation of the mechanism, the accumulation of sodium and the violation of the sodium calcium exchange mechanism, accumulative of the calcium, like after effect the cardinomyocyte relaxation deficit, energy deficit and lactic acid accumulation. Crash waves, it also like the limitation of the mechanism calls the condition when the hard load is more than the hard work. Means your cardiac endurance is low according to the workload. After that, the stable adaptation phase state of compensation means the RNA synthesis, increase in the ribosome, structural protein synthesis, activation of DNA and RNA, and the synthesis in the connective tissues, control proliferation. So after the happening of this, the result is the stable of adaptation of the heart. Like in 6% and a sportsman, continuous hard load, there are periods of hard load. Means the sportsmen have the high cardiac endurance as compared to the sick person. So like its body weight is hypertrophy, decrease in the capillaries amount, inadequate activity of the MCH, SPR, and most common it is the decrease of the nervous system amount of weight unit, decrease of the sodium concentration, and as compared to this, increase of the nervous structure amount of weight unit, adequate concentration of the sodium. Heart insufficiency is compensated, but the heart insufficiency in the sportsman is compensated by the hypertrophy, increase of heart muscles contraction. I told you earlier, it is about the endurance of your heart, means how much your load is mm, bear by your heart muscles. Exhaustion means the decrease of the correlation between the square cardiomyopathy surface and the cardiomyopathy volume and balance and pumps. Exhaustion state means decrease of MCH inactivity because calcium covered in the MCH and causes the disassociation of the oxidation of the phosphorylation, like decrease of the coronary blood flow, exhaustion of the connective tissue, decrease of the sodium. It is the exhaustion stage. Like what kind of symptoms, like fatigue, dependent edema, liver enlargement, ascites, etc. So violation of the blood circulation reduce the systole output, like decrease of output, decrease of systole arterial pressure, increase of diastole arterial pressure, increase of brain pressure. Like if I have to talk about the breathing violations, means the dyspnea means irritation of the breathing center by the CO2, attacks of the cardiac asthma at the night, like the atrium and the baroreceptors present in the carotid sinus, irritation and breathing center of the reflexes. Violation of the electrocytes includes the blood circulation violation, uh, the reflexes of the blood circulation, and the deficits of the blood circulation in the arteries. So the myocardial infarction, ischemic heart disease occurs when there is a particular blockage of the blood flow in of the heart. When the heart does not get enough blood to the work, it becomes starved of the oxygen. If the blood is completely blocked, then a myocardial infarction is occurred. Means in the patient who have the problem with cholesterol, when the artery is fully blocked, so there is no blood supply means to the heart muscles, and here is a condition called the myocardial MI, means the myocardial infarction. Ischemic necrosis of the myocardial tissues, which is related to the coronary like blood supply. Like statistics, morbidity increase, patient with the myocardial are younger year by year, and 30 to 40% chances of the mortality in the patient increases with the who suffer from the infection, myocardial infection year by year. Its etiology includes the atherosclerosis, the thrombosis of the coronary artery, the stage of 4, the a thromboembolism, and the spasm of the coronary arteries. Its risk factor are stress, um, like trauma, cold, negative emotions, increase, because of it, heart activity, increase of the heart activity, stimulation of the heart, and increase of the auto using. And it also includes the age like 40 to 59, hypokinesia, activation of the sympathetic adrenal system, obesity. Obesity is the main thing. People should know about the things that your sedentary lifestyle may be, you are more prone to the myocardial infarction. Males include the morbidity of the man in 2 to 3 times more the mortality rate in the man is 3 to 4 times. Everything is excessive in the men. Men to 45 this is a figure account and figures of the men that are affected by the MI, like 37% with the age gap of 45 to 59, 17 to 45 to 59, 55% and etc. So, risk factor hereditary arterial hypertension, diabetes mellitus is the main thing. And in infection, like the pathogenesis, it is the initial mechanism as a result of the atherosclerotic disease of the coronary artery, myocardial infarction go to the myocardial damage, and it is used, and it can cause a reduction in the contractility, like the progress of the remodeling, necrosis, ventricular dysfunction, and heart failure. Increase of the atherosclerosis plaque size, when the size of the plaque is increased, it can cause the narrowing of the vessel ischemia and a necrogenic ATP deficit. Like if the injured vessel is sensitive to the vasopressic effect, like damage to the endothelium, decrease of the anosynthesis, activation or decrease of no concentration, which is powerful vasodilator. And the thrombosis. What is thrombosis? Anticoagulant body activity decrease. Heparin is used for the activation of lipoprotein lipase at the and decrease in the anti-thrombosis properties of the injured endothelium. ATP deficit, as I told you, that decrease of the chromoxidase activity, violation of the electron transfer in the MCH, violation of the Krebs cycle. If the Krebs cycle will not be further into the electron chain, well, your body has a deficit of the ATPs. Accumulation of the acetylcholine A and fat acids, the deficit of ATP and CPH causes like acidosis. Acidosis means the accumulation of Krebs cycle metabolites, acetylcholine A, accumulation of fatty acids, pyruvate acid, and the lactic acid. Acidosis after fact means the main sign is ischemic area is depression of the cardiomyocytes contractility, and its mechanism is like the H positive ion interact with the troponin, and it causes the myosin in the releasing of the impossibility, so that the result interaction with the actin and myosin become the impossible. So that's why the calcium deficiency in the cytoplasm occur, because calcium cannot accumulate with the MCH. as you seen in the picture, that is a calcium accumulation, like deficit of the calcium return in the SP or ATP deficit. It is the picture of the necrosis, like the lipid triad, mean the phospholipase activation, lipid peroxidation, fat acid. After that, the hibernal myocardium, especially condition of the heart, which is characterized by the sharply decreased pump function of the heart without cardiomyocytes. Even the cytolysis as a result of the blood supply reducing. It is a protective reaction. Like signs include the decrease the ventricular output, decrease the using of ATP, the retardation of the cardiomyocyte necrosis, and the renewal of the H positive ions, like the concentration of the creatinine monophase level PCO2, the level of the carbon dioxide. It is during the 1 to 3 hours. In spontaneous recurrent process after blood supply restoring stage 1 include the hypokinetic, and stage 2 include the renewal of the synchronous cardiomyocytes, construction and left ventricle output rising at increased O2 need the organisms. This is the picture about this. But the factor of acute cardiomyopathy infection, like decreased cardiac output, tachycardia, arrhythmia, dyspnea, like systemic vascular resistance increase, blood volume increase, and increase in the circulating catecholamines, angiotensin, neurogenic peptides, and arginine vasopressin. And it is should be prevention by the comes from the sector of an African plant called the Staphylococcus gratus. It is a kind of thing that used to prevent the myocardial infection. Thank you so much. Inshallah, we will meet in the next lecture. So stay tuned.